Advantage Athletic Therapy, personalized rehabilitation programs with a whole body approach. Enjoy the podcast.
Good day, Dr. Amber. How are you today?
Hey, Dave, I'm good. How are you?
Good. Dr. Amber McKnight from Simcoe Optometric. But is it Norfolk Optical? I'm always confused. What's going on there? Tell me.
Our office is Simcoe Optometric Clinic. We used to have another division of our business called Norfolk Optical, but that has all collapsed into Simcoe Optometric Clinic. So yeah, we are Simcoe Optometric Clinic. I think when we call you, sometimes it shows up on the phone as Norfolk Optical, but yeah, we're Simcoe Optometric Clinic.
Today I want to go back. It's the New Year's February show, and I was doing some research for my wife on some stuff, and what I came across really kind of caught my attention. I didn't really think about it when my kids were really, really young. And you being who you are, I wanted to ask you these questions. When a baby's born, they already have vision. It's not great, but it's there. And I didn't realize that, I didn't even know when you start to bring your children to see you, like how young they should be. And I kind of want to talk about just that baby stage, because I think if you're a new parent, mom or dad, let's share that information, right? Let's tell them.
Yeah. It's a great topic, and I think it's something that a lot of new parents maybe don't think about, or there's not really clear information out there. But yeah, it's recommended that babies have an eye exam between the ages of 6 and 9 months, which seems pretty early. A lot can be, we can tell a lot from a baby's eyes just by looking at them and measuring them, the size and shape of them, how they move. Babies, you're right, they do have some vision. Infants will see clearly only about a foot away. So, and that makes sense. Their world is pretty small and close. They need to see things up close, but if you're waving at them across the room, they're not really going to be able to see that. But between birth and a year, you're right, the vision will develop pretty quickly to about 20/20 if everything's in good shape. But young kids, even by 6 months, we can get a good look at their eyes, make sure their eyes are healthy, make sure they haven't been born with any congenital eye issues, things like cataracts and glaucoma. We think about old people developing, but babies can be born with those things as well. There could be a big eyeglass prescription or a big difference in eyeglass prescription between the two eyes. So yeah, there are a lot of things that we're checking for, and our office is fully equipped to see infants 6 months. If that's gone by and you're thinking, oh my gosh, I'm behind the ball, toddlers, great age to bring them in for eye exams. They don't have to know their letters. I know a lot of parents want to wait until their kids know their alphabet, but we can check their eyes and be really thorough, even if they can't identify the letters on the eye chart. That's no problem. We usually don't do that test with kids. If you have baby through to toddler is a good first age. And if your kids are even older than that, even if you don't suspect a problem, an annual eye exam is a really good idea.
What are some of the things that you should be looking for as a new parent? We're all excited when we're that new parent and we want everything to be perfect, want everything to be right. But what's some of the things concerning eye contact that you would sort of look for, or you can recommend to folks just if they see something they're not sure about?
Yeah, for sure. Uh, Definitely, if you look at your baby and you see that their pupil looks white, or you look at photos and you see that their pupil reflex looks white, it should be black, or sometimes it's orange or red because the inside of our eye is kind of an orange color. So that color is normal, but a white reflex, it may be nothing, but it may be the sign of a problem. So definitely book an eye exam for your baby if you have seen a white pupil. Looking for eyes that kind of line up. So if you're looking at the baby, if one eye looks like it's turned in or turned out, watching that they track you by about age 4 months. They should be, following you as you're walking. They should be smiling and reaching for objects, meeting their developmental milestones. If that's behind, definitely worth bringing them in and having an eye exam.
It's really cool too, because I didn't realize that the visual and the hearing elements are developing a fair amount in the womb. Like they're already hearing, they can already see a little bit. Their shadows are there, but that's just incredible. And then you were telling me off air that, if there is a problem, it's a great time to correct, right? It's to help that baby into those next phases so that they can catch up, or, I don't want catch up's not the right word, but, to have a stronger eye if they have a weak eye or something. Can you explain that a bit more for me?
Oh yeah, for sure. Yeah, we were chatting a little bit how, I like to think of your eye's like the sensor that's picking up the information, but you see with your brain. You see with the visual areas of your brain at the back of your head, there's a nerve that connects your eye to that part of the brain, your optic nerve. And your visual centers are actually developing until you're into your early teens. So if an eye problem does not get addressed early on as an infant, but it gets addressed in childhood, oftentimes things can be corrected. Your vision can still develop and improve into your early teen years. So, again, that's something that we do some in office, or we work with vision therapists to improve kids' vision. So, definitely, it's amazing how our brain works and how our eyes work, and we got to take good care of them.
And you were telling me too that at 6 months it's covered by OHIP, right? As soon as they want to get the child in, and maybe just relay that message as well.
Yeah, yeah. So Ontario, there's coverage for eye exams for kids right from birth up to age 20. So until you're 19, you can have an OHIP covered eye exam. They'll cover a full exam annually, and you can come back for a recheck. Something's changing, or something new has shown up, or we need to do any follow-ups. Those are usually all covered as well. Sometimes there's some additional testing that might be recommended that wouldn't be covered, but that will always be talked about before your visits. Definitely the assessments are covered by OHIP, so you just need your OHIP card and you can come in. It doesn't cost you anything.
I think too, as a young parent, peace of mind, coming to see you, is precisely what you're looking for. That's one less thing you can check off and then come back in the next year and do it again. But I mean, I just think it's so important. I didn't realize, to be honest with you, how important it was at that early stage, and some of the things that, like you mentioned, that could go wrong, but they can be corrected. But so, new parents, this is just a show for you. Make sure you get that child in, that baby in, and let Dr. Amber help you out. And just peace of mind, folks, peace of mind.
Yeah,
Hey,
that's
what's
true.
going on in February? What's going on in February?
Oh, well, February is Macular Degeneration Awareness Month, so we're kind of going the other end of the spectrum here, but we take
Yeah.
care of, babies right through anybody's age. So, it's an eye disease that I think a lot of people do have quite a bit of awareness about. But again, I always keep reiterating, even if you don't have any signs or symptoms of an eye problem, your vision seems great, you can see better than your spouse, or you've got really good vision, you still need to get your eyes checked annually. Macular degeneration is one of the leading causes of vision loss in North America, and it is preventable, it is treatable. The key is early detection. So coming in and getting things checked, just want to make sure people know, even if you're not noticing any problems, call us, come on in. We take a really good look at your eyes. We've got some advanced technology to image the back of the eye and manage and treat macular degeneration. We work together with ophthalmologists to get more advanced treatment when needed. So give us a call, come in, get those eyes checked. It's Macular Degeneration Awareness Month.
How do people get a hold of you? Can they email, phone? Give us all the details.
Email, phone, get a hold of us through Facebook message, text us, call us. We're here. We'll get back to you right away and get you booked in, get your eyes checked.
Hey, if a young parent just has a question, can they call you?
Oh, yeah, definitely. Yep. Call, no
Okay.
problem. We're happy to chat over the phone, email, text. Again, social media, you can contact us through Google, through Facebook, through Instagram.
Thanks for doing this. I really appreciate your time. This was an interesting conversation.
Yeah, great. Yeah, always excited to talk about that.